Hi everyone, I'm here to give you my 7-week update after having thoracic outlet surgery. I was intending to do my 6-week update, but I actually returned back to work last week. So it was a little bit hectic and being able to spend time to do this, and as well as getting back into the flow of things. This will be a very short video just to give you an update. As far as physical therapy, I noticed that I am building up my endurance. I'm able to do more reps or more rounds of exercises, but I am still feeling the pain afterward. So I'll notice that I'm able to do exercises, and it's mostly emphasizing strengthening those back muscles that got really weak, and also with engaging my core, because that was also very weak while I was having all the issues with thoracic outlet syndrome. So I've noticed that on physical therapy days, pretty much afterward, I'm kind of spent. By the end of the day, I'm having pain along my sternum, that breastbone, kind of right in the middle, and an ache toward the back. So this heating pad has really been my good friend. I do recommend using an extra long one. And what I do is, since I had mine on my left side and they had to do some scalenectomy and get rid of some of the scar tissues. So what I would do is I kind of start it in the front and then I'll wrap it to the back, kind of angled toward my midline or toward my back. And that seems to target my muscles very well. And I'll leave it on for maybe 30 minutes at a time. I'm gonna start doing like some Epsom salt soaks to see if that helps with the magnesium that's in it, to be able to help relax my muscles. And then I've been trying to do stretching, and I've been kind of going toward like yoga stretching and ab work, but not crunches. So stuff where my torso is flat, and then maybe doing like leg lifts or bicycling, but nothing where I'm kind of bringing this forward, because I don't want to strain my neck, because I know that these muscles here are still affected from surgery. I also wanted to know, if you are employed and you're trying to get disability through your employer or through your insurance, document. Make sure that you have notes from the surgeon, recommendations about how long you need to be out. If you are starting physical therapy 2 weeks after, make sure all the symptoms that you have, make sure you're documenting it and letting your physical therapist know. When they're doing all of your evaluations, make sure all the range of motion stuff is in there as well, and know any issues. Try to make sure you're getting follow-ups within that disability period. I ran into an issue where they only temporarily approved me. They asked me to be out 6 weeks, and they only paid out a portion of it because they said there was inadequate documentation, even though we were giving them information left and right. You need to know that thoracic outlet syndrome is not a very common condition. It happens, sometimes you'll see it with people who are in car accidents, or in some people who are professional athletes, because of what they do every day, they're stressing out those certain types of nerves, and that nerve bundle gets compressed. But it's not a common issue. So if you have a claim manager or a case manager that is not familiar with thoracic outlet syndrome and the intensity of what you went through in surgery, it's most likely that they'll try to limit your time. And it's not like a regular decompression surgery. I had one on my arm before, and yes, you're able to bounce back from those a lot better. I think some people are not realizing when someone cuts out a rib and they literally open up your muscles in your chest and they're taking out scar tissue, that even though your wound is healed, like the surgical wound is healed, there's a lot of internal healing that still needs to go on. For example, I'm a singer, and I do a lot of very lively music, singing, dancing, jumping up and down, that kind of stuff. Well, that's part of my normal routine, and that's how I gauge whether I am doing better or not. And I had a thing where I was trying to sing on the 5th week, and had been doing pretty good. And in the first song, it hit me really hard. It felt like someone punched me in the chest, and I had trouble catching my breath. And then I had pain for 3 days that just kind of echoed throughout my chest cavity, front, back. It just felt like everything was kind of there. So the pain that you are feeling is valid. There are issues that are going on internally. Yes, the scar is healed, but there's a lot more internal healing that's happening. So the process is slow. It's exactly that, a process. I've noticed physical therapy is kind of like a 2 steps forward, 1 step back kind of process, that I'm doing great. Yes, I'm doing more repetitions, but then I'm kind of spent for the rest of the day. So make sure that the pain that you have is valid. Everyone heals in a different rate, but if you are still having issues, don't push it. Don't try to push yourself beyond what you can do, because you will suffer the consequences in the following days. And that's something that I want to be able to avoid you going through if you have to. There's not a lot of information about thoracic outlet syndrome, which is the reason why I wanted to start up this channel, for those that were looking for information, that feel like their concerns are going unvalidated. No, there's something going on in there, and you need help. You need to be able to get the care and the treatment that you deserve. So I know that this isn't necessarily medical related, but it's still thoracic outlet syndrome related. This is something that you're going to have to go through after you have surgery, and I want to be able to provide you with that information that you need. If you have any other questions or concerns, make sure to comment me below. I'm usually pretty responsive. Make sure to like and subscribe. I will still continue to do updates. I want to be able to give you updates throughout the months, a year out, 2 years out, 5 years out, because there's not enough information out there, and I want to make sure that you're informed. Also, for those, we are in the coronavirus time. I know there can be some concern when you go to physical therapy. Make sure you wash your hands before and after. Make sure that your facility has very good cleaning techniques. I know mine has always been very, very clean, and I see them do the cleaning, and it's very, very thorough. But make sure you stay safe out there, and let me know if you have any other questions. Thanks. Have a good one.